What is the difference between efficacy and effectiveness in clinical trials? Imagine you're trying out a new recipe. Efficacy is like testing the dish in a perfect kitchen with the best ingredients and no distractions. Effectiveness is how the same dish turns out when you cook it at home, with your own ingredients and sometimes a busy schedule. That's a simple way to understand the difference between these two important ideas in clinical trials. Efficacy measures how well a treatment works under ideal conditions. In a clinical trial, researchers carefully select participants who meet strict criteria. They often exclude people with other health issues to see if the treatment itself works without interference. The treatment is given exactly as prescribed, with no missed doses, and side effects are closely watched. For example, a new cancer drug might show high efficacy if every patient takes it exactly as instructed and responds well. Effectiveness looks at how well the treatment works in everyday life. It includes a broader group of people, like those with other health problems or who might not follow the treatment plan perfectly. It shows what happens when the treatment is used in real clinics, hospitals, or at home. For someone who has survived cancer, effectiveness is often more relevant because it reflects how the treatment performs outside the controlled environment of a trial. The main difference is the setting. Efficacy is about the potential of a treatment in a perfect world, while effectiveness is about how it works in real life. A treatment with high efficacy might not always be highly effective if it's hard to take, causes side effects that make people stop, or doesn't work as well for people with other health issues. Knowing this helps survivors and their healthcare teams make better decisions. If a treatment shows high efficacy in a trial, a doctor might recommend it. But they will also consider how it has worked for others in real life, which is what effectiveness shows. Survivors should ask their doctors about both the trial results and how the treatment has performed for others with similar health backgrounds. When choosing treatments, it's important to remember that efficacy shows what's possible under perfect conditions. Effectiveness shows what's likely to happen in daily life. Both matter, but for those living after cancer, understanding how a treatment performs in real-world situations can be more helpful. This knowledge helps survivors have more informed conversations with their healthcare providers and choose options that fit their everyday routines and needs.